This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So Adriana Garcia is our program manager, and she just jumped on, so she will be pulling up our slideshow. But I did want to just say a really big thanks to PM&R Scholars for hosting this event tonight. I think this is such a great opportunity for medical students who are interested in the field to learn about the different programs. So thank you so much. It's fantastic. And I want to, I can turn on my video here. I want to welcome all of you who are here to learn about the PM&R trainings across the country tonight. My name is Pam Hansen, and I've served as the residency program director at the University of Utah for 13 years. Adriana Garcia, our program manager, has been my partner in this role the entire time. So we've had a lot of experience in this and absolutely love working with our residents. We also have two great associate program directors in Dr. Allie Fliss and Dr. Brady Godfrey. And we have a very supportive chair in Dr. David Steinberg. Having strong leadership overseeing the training programs is very important, and it's something we really take pride in here. I'm really excited for all of you who have found PM&R and decided to pursue a career in this field. I initially learned of the field when I was a third-year medical student at Northwestern, so a little bit later in the game. And I learned about it because it was a required rotation at RIC at that time, Rehabilitation Institute of Chicago at that time, now Shirley Ryan. So like I said, I found the field a bit late, but I'm so grateful I did. It's really a fantastic field. I had a great experience during my residency training, which was at the University of Washington. And subsequently, I came to the University of Utah for the sports medicine fellowship, and I've been here ever since. So close to 20 years now. And it's really been a fantastic place to work, learn, and play. So I'm going to run through a few slides tonight, highlighting some aspects of our program, but you can find much more information on our webpage. And you can also join us for Wasatch Wednesdays over Zoom on Wednesday nights. We had one last night. We have four more coming up. And you can also talk with our chief residents during their office hours. We'll have links to all of this information at the end of our slideshow. Next slide. All right, so first I want to say that the University of Utah is consistently rated amongst the top academic medical centers in the nation in terms of quality care. And our partners in the School of Dentistry and colleges of nursing, pharmacy, and health are also internationally regarded research and teaching institutions. So it's a really robust, collaborative, and exciting place to train. Also, many people don't realize that we have a strong commitment to promoting equity, diversity, and inclusion here at the University of Utah, and we've been recognized for our accomplishments in this area. So I just wanted to highlight that. The University of Utah Health is the Mountain West's only academic healthcare system. So we provide care for Utahns and residents of 5 surrounding states in a referral area encompassing more than 10% of the continental United States. So we have really a high volume of patients coming through here. Next slide. Our GME provides excellent oversight of the clinical learning environment, and they oversee 927 residents, 28 different residency programs, 66 accredited fellowships, 27 non-accredited fellowships. So you get great experience working alongside all of these different specialties. The Craig H. Nielsen Rehabilitation Hospital is a beautiful state-of-the-art hospital, which just opened in the spring of 2020. Covering 10% of the landmass of the continental United States, we see a large volume of patients covering the full spectrum of diagnoses, from bread and butter stroke patients to the rare zebras. You'll have the opportunity to treat them all at the Nielsen Rehabilitation Hospital. Some program specifics. So we were founded in 1965, so we're very well established in the hospital, but we're also a very flexible program. So we're continuously assessing our rotations and experiences to stay up to date with the latest in teaching methods, therapeutic interventions, et cetera. We have 6 to 7 residents per class for a total of 26 residents in our program. And we offer diverse training across many settings and populations, including the University of Utah or Nielsen Rehabilitation Hospital, the VA Medical Center, Primary Children's Medical Center, the Huntsman Cancer Hospital, as well as covering several community centers and clinics. And all of our main rotation sites are within 1.5 miles of each other, which is really unique and very awesome for our trainees. Culture is super important to us here. So our goal is to provide the highest quality, comprehensive training in physical medicine and rehabilitation. We strive to maintain a positive learning and working environment and teach with positive reinforcement and clear feedback. The relationships between faculty, staff, and residents is really amazing and creates an optimal environment for training. We have a robust mentorship program here. We have both faculty mentors to provide support and guidance, as well as resident mentors in the form of pods. And our pods include 1 resident in each class, so an R1 and R2 and R3 and an R4 that come together and kind of create a little family. This has been a real positive experience for residents and helps everyone feel more connected right away when they come to Utah. So in our program, we have 26 residents over 4 years. So we are a categorical program. We have 31 full-time faculty, so more faculty than residents, which is a great ratio for education. We do have protected didactic time, 4 hours per week, and this is done on Thursday mornings, as well as journal clubs, grand rounds, clinical safety case conferences, and senior symposiums. So lots of structured educational experiences. We also offer 3 specialty tracks, and residents can choose to participate in any or all of them. And they're the research track, the education track, and the lifestyle medicine track. We have no overnight call. We've gone to a night shift rotation in the last couple of years, which has been a very positive experience for trainees. So our rotations at the Nielsen Rehabilitation Hospital, our main site, we have 7 residents. So 4 inpatients, and our 4 inpatient services are the stroke service, the TBI service, the spinal cord injury service, and the complex rehabilitation service. We have a consult resident, a clinic resident, and a senior resident. The University of Utah Orthopedic Center is where our sports and spine rotations occur. At the VA hospital, we have 7 residents there at a time. There's a small 5-bed inpatient unit, as well as a multitude of clinics covering amputee, musculoskeletal, neuro rehab, polytrauma. Lots of EMGs and procedures happen at the VA, and there's also a supervisor position there. At Children's Hospital, there's a wide variety of outpatient rehabilitation clinics. There's also opportunities for consults and inpatient experience. And there's also elective time during your senior year. As residents progress through their years of training, you do have more input into your rotation schedule to customize it to your specific desires and needs. In terms of our didactics, we have an 18-month curriculum, so you go through it twice during your training. It's faculty organized and run with a lot of direction and feedback provided by residents. And this is updated every cycle. So we have modules covering the full scope of PM&R that are kind of listed here. including didactics in research, quality improvement, as well as the business of medicine and practice management. We have journal clubs at each site. Grand rounds happens once a month. We have senior symposiums and patient safety case reviews, which is a form of, it's kind of like an M&M conference. It's learning from errors and improving our system. And those happen quarterly. We're devoted to really helping our trainees be successful in scholarly activity through both research and quality improvement initiatives. So in terms of research, we do have research didactics. We do provide research mentors for every resident. We have a list of existing projects that's sent out to you so that it's easy for you to jump into existing projects that you might be interested in. And we also have a research committee to provide support with things like study design, getting through the IRB, finding grant funding for your projects, that kind of thing. In terms of quality improvement, we also have quality improvement embedded within our didactics throughout the year. And every year, we'll do a quality improvement project as a residency program. So by the time you graduate, you will have completed 3 projects. So where do our residents go when they graduate? Really all over the country, as you can see by this map. So this really demonstrates you're well prepared to go anywhere and do anything when you graduate. We have graduates who go into private practice or group practices in rural areas to cities. We have residents who go right into academic institutions. Many pursue excellent fellowships. This next slide is just a demonstration of where our residents have gone over the past 2 years. So you can see many of them have gone on to do a wide variety of fellowships, but many have also gone on to do private practice and academic jobs. We also have our own fellowship training programs. So we have our sports medicine fellowship led by Dr. Willick, our spinal cord injury medicine fellowship run by Dr. Jeff Rosenbluth, and our interventional spine fellowship run by Dr. Zach McCormick. We also have three psychology postdoc fellowships in our program. We have a robust wellness program. So Rob Davies is our GME wellness director, and he meets with our residents regularly. We have 3 resident wellness champions, Justin Foley, Austin Lee, and Dan Carson, who, if you were on Wasatch Wednesday last night, you heard Daniel talk a little bit about the wellness program here. But the wellness residents help plan social events, activities, and retreats to really promote camaraderie and wellness amongst the residents. So life in Utah is truly spectacular. So we sit at about 4,200 feet in the city, and we have the Wasatch Range in our backyard, which is up to 12,000 feet. So this is not the kind of place where you have to drive 2 hours to get to the mountains and hike. It's truly after work, you can get out there and go for a beautiful hike in the mountains. We have 11 world-class ski areas within an hour, 7 national parks, as well as 7 national monuments, all within 5 hours of here, and numerous wilderness areas and national forests. So it truly is the playground of the world if you like the outdoors. But if you don't like the outdoors, there's also a lot of other activities going on. So we have some great restaurants in Salt Lake. The music scene is actually really good. This top left-hand picture is of Red Butte Gardens, which is my favorite music venue. Really beautiful outdoor amphitheater. We have professional dance, a lot of great theaters, as well as professional sports teams. My husband and son just went to a Real Salt Lake soccer game last night, and we beat Minnesota 3-0. I'd have been happy if Minnesota won too, actually, since I'm from Minnesota. It was a win-win for me. So overall, what we have to offer is a balanced exposure to the entire scope of PM&R, excellent procedural training, opportunities for sports and adaptive sports coverage and experience, a comprehensive didactic curriculum. And I should add, opportunities for the different resident tracks, so research, education. And this is the first year we started the lifestyle medicine track, which is really exciting. Devotion to scholarly activity, dedication to a high quality of learning, and a high quality of life, really working with a wonderful group of residents and faculty. Just more pictures. And this is a listing of our Wasatch Wednesdays. If you haven't known about them or been able to join them so far, there's still 4 more coming up. Our next one is September 14th, which is pediatrics. And what we do is we cover a topic. So we'll have a faculty member cover a topic, and then residents who talk about an aspect of kind of life in Salt Lake. So it's a great time to get to know us a little bit and to ask questions. So chief resident office hours are listed here, and you can find this all on our website as well. So that is my presentation, and we are happy to take any questions that you might have.
Thank you so much, Dr. Hansen. We have 5 more minutes. So everyone feel free to drop questions for University of Utah. I believe there's a question in the chat. Can you talk more about the lifestyle medicine track?
Yes, so that is a new program this year. So we are one of many institutions around the country who have joined the lifestyle medicine curriculum. Family medicine and PM&R at the University of Utah are both kind of members of this group now. And it's a structured curriculum that you can go through over a course of 3 years. Some people are doing it in an accelerated fashion. We have a couple senior residents who really want to complete the track before they graduate so they can sit for the board exam. But it's a number of, it's 40 hours of didactics that we go through, a lot of group activities that we do together, experiences kind of working with the community, it's 400 patient encounters covering lifestyle topics. So it's a whole curriculum that we've kind of signed up for and joined this group. So we're building some of it into our didactic module. Some of it is independent, and we're creating a lot of group experiences that count as the group activities. I hope that answers the question a little bit. A lot of our faculty are doing it as well. There's a lot of interest in getting certified for this. It's such a great fit with PM&R. So the overnight rotation. So it is a 2-week stint at a time, and it's from 5 p.m. to 7 a.m. And it basically allows every other resident in the program to not take overnight call. So it's not awesome when you're on it, but it's a 2-week stint, and I think it kind of protects you for maybe our residents. I don't know if any of our residents want to speak a little bit about it. This was a change that actually came from the residents, and I think has been just a really positive. They've really appreciated it. And interestingly, I think it's great for patient care, having a resident in the hospital at night, and nurses love it too. So it's sort of been a win-win all the way around.
Yeah. Hey guys, my name's Casey. I'm a 3rd-year resident here. I'm actually on the night rotation right now.
And it's so much fun.
It is fun, right? Weird, in a weird, odd, strange way. No, it's good. It's busy, and the nice thing is we make sure you have at least a month on the inpatient teams prior to doing a night rotation. So you're comfortable with the hospital, you're comfortable with how it works. And it's great because you get to manage a lot of things on your own, and which is a really fun skill to work on. And then you always have attending support that you can get in touch with whenever. So it is actually, 2 weeks of a pretty busy, fun time and working on your medicine skills.
And I just comment regarding the night float versus home call system. This change happened my first year as a resident. I think we were the first class to have it fully implemented, maybe the class before us. But when you're working at a busy rehab hospital, home call can sometimes sound good, but often is not good, because any place that's busy, you're going to be guaranteed to get called quite a bit overnight. And then you end up having to go in the next day, pretend everything's normal, and work the full day. So often you end up just working constantly. So this night float system has fixed all of that. And for people, I'd say if you're not a heavy sleeper, or you're not like a person who needs a ton of sleep, it's actually a great rotation. When I do it, I don't flip my schedule. So I just sleep when I can at night and maybe take like a small nap during the day if I have to. So it ends up being actually a pretty good rotation for folks like that. If you have to flip your schedule and do the full hours that way, it can be a little harder, but it's been a great change, I think.
Yes, thank you so much, University of Utah. It's great to see a lot of faces representing. So please, everyone, drop your questions in the chat for University of Utah, and we can welcome WashU next. Last but not least, of course.
Thank you so much.